Again, welcome everyone. I am happy to open this session, Journeys of Ukrainian Refugees in Poland, Moldova and Romania. My name is Irina. I will be the moderator of today's session and maybe partially a co-presenter of some of our findings. This webinar is organized by Ground Truth Solutions together with Open Space Works Cooperative, and our goal for today is from one side to present concrete user journeys of Ukrainian refugees, which we created as a result of a survey in Poland, Moldova and Romania that was conducted by Ground Truth Solution and Open Space Works starting from March till the end of April this year. Also share with you some of the observations, key findings and recommendations from people to whom we talked to. After the presentation, we will have a panel discussion with practitioners who are working in these three countries supporting Ukrainian refugees. We will have speakers from UNHCR Poland, UNHCR Moldova, Safeguarding Hub Eastern Europe and Migration Consortium Poland. We will also be able to hear from you. So we will have a section where you could also share your good practices, examples of your work, solutions to address the challenges of Ukrainian refugees in Poland, Moldova and Romania. And of course, we will be able to answer your questions, comments. As Rika already mentioned, we are working in a webinar mode. This means that everyone who is joining this session is automatically muted, and you can't unmute yourself by your own. You need to either use the Q&A function in the menu of the MS Teams, or use the raise your hand function so that me or Rike could unmute you and give the floor for your questions or comments. We are working for 1.5 hours. So these are our basic housekeeping rules, our framework for today. And I am happy to pass the mic to Rike and Sergey, who will present the actual findings of the Ground Truth Solution survey in Poland, Moldova and Romania. Please, Rike.
Thank you, Mariana. Hi, everyone. My name is Rike Vingerling. I'm a program manager at Ground Truth Solutions and working on our projects in Ukraine, Poland, Romania, Moldova in this context. Mariana already went through the agenda, and I briefly want to speak a couple of words about Ground Truth Solutions, about our organizations, what we do, before going into the findings of the user journeys and the social media survey that we did a couple of months back. If you have any questions or comments, please do raise your hand or share your questions or comments in the Q&A. And I hope that it will be a very engaging session today. So feel free to let us know if you have any thoughts on the findings, or if you want to share anything. The idea is to exchange as much as we can today. So I invite you all to be very vocal. All right, so about Ground Truth Solutions. We are a small international organization based in Vienna, and our objective is to systematically collect and analyze the perceptions and priorities of affected people on the humanitarian response, to share the perceptions and views of affected people with humanitarian actors so they can take them into account into programming, and to support decision-making based on these perceptions. And we always give this example of what we do. So we do not track humanitarian activities, but we track aid recipients' experiences. For example, we do not track if agencies have feedback mechanisms, but we ask affected people, do you know how to make feedback, or how to make a complaint or provide any feedback, and see what responses people have about this. So then on to the methodology and the project that we have been implementing in the last year in Poland, Romania, and Moldova. We have conducted quantitative research and qualitative research in all 3 countries. For the quantitative research, we have tracked the perceptions of refugees from Ukraine about aid in Poland, Moldova, and Romania between January and February 2023 through a social media survey. So what we did is we identified social media groups where a lot of refugees from Ukraine were speaking about aid they needed or received. And then we targeted people who had received aid since the full-scale Russian invasion or who identified in need of humanitarian assistance over 18 years and older to understand their perceptions on the aid they had received or they needed in these countries. So the objective of this social media study was to capture the experience and perceptions on aid of Ukrainians in the neighboring countries. For the qualitative research, we did a more extensive research. We mapped the journeys of refugees from Ukraine in Poland, Moldova, and Romania. And data collection for this was done between January and March, and the project was ongoing until this month. And we conducted for this project key informant interviews and used a user journey approach. And I will discuss later what this user journey approach entails. The target groups of our qualitative research were women with children, people with disabilities or chronic illnesses, young people, but over 18 years old, and people from the Roma community. And the objective of the qualitative study was to explore the unique perspectives and experiences from people's journey from Ukraine to their host countries, their first experiences with aid along the journey, and their more regular experience with aid in their host countries to identify bottlenecks, problems people faced, but also to identify potential solutions of how the journey of people receiving aid could be improved. So the user journey approach involves a creative problem-solving process that visualizes individuals' experience. So our aim with this approach was to explore how different groups of people with different vulnerabilities experience humanitarian assistance in order to develop recommendations from their perspective through a series of qualitative interviews and the creations of personas. For this research, we created 9 personas, and you can see the people who you can also read about in more detail in our report on the right side. The approach was applied to the experiences of Ukrainian refugees in Poland, Moldova, and Romania. Their journey, of course, started in Ukraine, and through transitions and various stops on the way, they landed in their host country. We did in total 36 qualitative interviews with people of different vulnerable groups, as I mentioned before, youth, people from the Roma community, people with young children and older persons or with chronic illnesses. And we created these 9 fictional personas that highlight the needs, goals, drivers, behavior of this group of individuals. Each persona provides a tangible identity to represent a group of people with shared characteristics. The personas enable understanding of how different characteristics impact affected people's experiences. And this approach encourages people to tell their stories by describing their actions, feelings, perceptions, so that the humanitarian community can better understand the individual stages of their experiences and going beyond an operational system-centered view, but rather using a human-centered understanding of how different types of people experience the humanitarian infrastructure. So that was all about the methodology. I will go on presenting the key findings, and the findings will be both from the quantitative research and from the qualitative user journeys. I will start with the key findings that we got from both type of research, and then tell you 4 of the journeys of the personas that we worked on in the last couple of months. Refugees from Ukraine we spoke to described the journey to Poland, Moldova, and Romania as both physically and emotionally draining. Most took a non-linear path to getting to their destination, stopping along the way to decide whether to settle or continue their journey based on their knowledge of accommodations, services, the job market, and social connections they had in various locations. The journey was particularly difficult for those with children or dependents, standing in line for hours at the border, lacking clarity on their destination, and sometimes feeling guilty for leaving other family members behind. The border crossing itself was often described as one of the most exhausting parts of the journey. Many people tell us that they had to queue at the border for up to 12 hours. Almost all people we spoke to through social media studies across Poland, Moldova, and Romania need aid despite already receiving assistance. This shows that most people who receive support are still dependent on it. Refugees from Ukraine have low expectations of the humanitarian response. Despite this, all their expectations remain unmet. People do not feel informed about aid available to them, they do not feel consulted on their needs, and they do not feel that they can influence how aid is provided. In-person registration is one of the most common ways to register for assistance, and some respondents, particularly mothers of young children, find it difficult to do in-person registration and suggest the adoption of remote registration because they have to travel to in-person registration sites, for example. People we spoke to also mentioned that while the process of registering for temporary protection is simple and organized, for many, the challenge is to get to the place of registration, as I mentioned. Especially for those who are not residing in the capital or big cities, they have to travel far to go, which can be time-consuming and stressful. Refugees from Ukraine we spoke to mainly obtained information about humanitarian assistance through personal contacts from other refugees in accommodation centers or during registration, from host community volunteers, or through unofficial sources such as social media groups. They would prefer, however, to access information via official channels, which they perceive as timelier and more accurate. Older people and less literate people find it extremely challenging to obtain relevant information about aid, especially due to language barriers. Most people do not know how to ask a question, file a complaint, or provide feedback to humanitarian actors, or if they had done so, had not received a response, which reduces trust in feedback mechanisms. Most people find it very difficult to ask for help. People we interviewed are generally extremely grateful to their host communities, but they have feelings of shame too. For most, this is their first experience with humanitarian assistance, and before the full-scale Russian invasion many had decent jobs and comfortable living conditions. Now they feel hesitant to ask for help. Refugees in all three countries told us that they want to know if aid is distributed fairly and would appreciate understanding why some people receive aid and others do not. People we spoke to do not know how humanitarian aid providers work, what aid is available, or how it is distributed. So then I'll move on to the journeys that I will present now, 2 in Poland, 1 in Moldova, and 1 in Romania. And before I go into the journeys, let me see if there's any questions. I'm just going to start the discussion in the Q&A. I will ask Serhi if you can just start in the Q&A and post a question if anyone has any questions so people can reply to that. So now on to the user journeys from Ukraine, the journeys from Ukraine to Poland, Romania, and Moldova. We will start with Poland. 94% of the respondents we spoke to through social media received humanitarian assistance since arriving there. Most people received food, received cash assistance, or non-food items such as clothes or medication. 72% of people say they need cash, health services, and non-food items in Poland. In Poland, we analyzed the journeys of Svetlana, an older woman with a disability, Jana, a mother with young children, and Maria, a woman from the Roma community with young children. I will start with presenting the journey of Svetlana. Svetlana is from Nikopol, from Dnipropetrovsk Oblast in Ukraine, is 65 years old, and she left Ukraine with her granddaughter as she was scared for her safety. She decided to take the free evacuation train to Lviv and then a regular bus to Krakow. They stayed for some time in a room in a local school that was sheltering refugees from Ukraine outside Krakow, and then found another accommodation through a Facebook group. And they are now living in a hostel for refugees in Rabka-Zdrój. When they arrived in Poland, they registered with ZUS, a Polish state organization responsible for citizens' health and pension insurance. And they also have PESEL, which is the Polish ID number, that enables them to register for a specific residence card for Ukrainian refugees in Poland. Volunteers helped her register, and she said that the application procedure wasn't too complicated, especially because she was helped by volunteers. When she stayed in Krakow in the shelter set up in the local school, she explained that the living conditions were quite poor. It was overcrowded, with many people sharing the same room. She also mentioned that the food was not appropriate for her health needs, as she has type 2 diabetes and hypertension. They are now living in a hostel for refugees in Rabka-Zdrój. However, the problem is that the hostel is very high up in the mountains, and every time she needs to leave to get the groceries, visit a doctor, she struggles to go back because of her health conditions. For her, living in Poland is really challenging without the help from local volunteers and other Ukrainians. Otherwise, they wouldn't manage. From our quant research, we see that the vast majority of people we surveyed have received or are in the process of obtaining a certificate with temporary protection status. In Moldova, this only became possible to obtain this status from March 1st this year, which we'll also discuss a bit later. Refugees from Ukraine in Poland, Romania, and Moldova perceive access to assistance differently. Survey respondents in Moldova are most satisfied, with only 17% of respondents finding aid access difficult, but those in Poland and Romania paint a more negative picture. 64% of refugees in Poland and 47% in Romania struggle to access aid. In Poland, the government provides refugees with cash assistance through the 500+ program. Svetlana said that the city administration, also once provided them with vouchers for shopping in a supermarket. They receive hygiene packs, free clothes, and food packs once a month. As a diabetic, she receives special food packs. Sometimes they change, and sometimes people get more than others. Her granddaughter was given new shoes, and the teacher gave her some dresses. When it comes to medical assistance and drug prescriptions, the procedures are long and complicated, said Svetlana. She found it challenging to apply for humanitarian cash assistance to spend on medicine and doctor's visits. From May 2023, Ukrainian refugees have to cover 75% of accommodation costs. But because a lot of people are aware of the new policies, they haven't applied to other programs to cover these additional costs. Generally, Svetlana say they lack money to cover ongoing needs. With that, I will go to the next journey of Maria, a 27-year-old woman from the Roma community and a mother of 3, who lost her documents at the border when leaving Ukraine and has now, because of that, limited access to aid in Warsaw. Maria's journey was quite long and complicated. She was first displaced in 2014 from Horlivka, Donetsk Oblast, to Kryvyi Rih in Dnipropetrovsk. When the full-scale war started, they took an evacuation train to Odessa, then took a free bus to the Moldovan border. After crossing the border, they stayed in a tent for one night. They took a bus to Romania. They arrived in Bucharest and were welcomed by volunteers, stayed there for a week, continued to Hungary on the train, stayed in Budapest for one day, and then took a train to Warsaw. In Warsaw, volunteers met them and let them stay in a refugee shelter for 2 weeks. Before the full-scale Russian invasion, Maria had a well-organized life, lived in a family house, worked in a local restaurant. She left Ukraine with her partner and 2 children. She was also heavily pregnant with her 3rd child. They were lucky that her partner had permission to leave the country because of his health condition. They moved to Poland because her sister moved there too, and she felt more comfortable moving somewhere where she knows someone. That was often a decision factor for people to choose a destination. The shelter in Warsaw was a cinema, and they shared a room with another family. Maria gave birth to her 3rd child while being there, and the living conditions were not appropriate for her family anymore. She complained about the shelter's food to the local volunteers, but they said they couldn't do anything about it. Volunteers at the railway station helped them find a more suitable accommodation, so they moved to another hostel. 8 people currently live in an apartment with them. The rent is free, and they still get volunteer support with food, medicine, and hygiene products. Based on our survey, most people have applied for aid at least once, and most people in Poland, 75%, have applied for aid through online applications, shared links to social networks and media, but also in-person registrations. The aid people received is mainly food items, cash assistance, and non-food items such as clothes, medication, shoes, and so on. When arrived in Poland, Maria and her sister struggled to receive food for their children at the main humanitarian center. They said that she saw a lot of child formula and diapers and boxes, but she didn't receive any of it. When asked why, they said they didn't have enough for them. They only received 1 diaper per day per child, and she doesn't think there's enough food, but people can't complain about it. In all countries we spoke to people people named UN and UN-related organizations as the main provider of humanitarian assistance, followed by international organizations, followed by local volunteers, and faith-based organizations play also an important role, especially faith-based organizations in Moldova. Across the 3 countries, around 30% of people said they received aid from local volunteers. Maria said she's mostly supported by Roma volunteers at the Roma Humanitarian Center. They ask her about her needs and try to meet her requests. Volunteers from the Roma community also found an apartment for them. An overwhelming majority of refugees from Ukraine continue to need humanitarian assistance, so it's crucial to understand coping mechanisms that enable them to live without this reliance. In our survey, most people mention getting a job, 20% in Romania, 18% in Poland, seeking help from family and friends, and depending on the country, using savings and reducing consumption to deal with the fact that their most basic needs are sometimes unmet. Now we move to Moldova. In Moldova, we spoke to we had the personas Petro, a 51-year-old man with a disability who finds it difficult to access humanitarian and medical assistance in Balti. Olena, a 19-year-old student who lacks appropriate space to arrange the online learning in the refugee center and is missing social opportunities in Edinet. And Natalia, a 29-year-old mother of 3 who is struggling to ensure a safe environment. I'm going to present the story of Natalia in Moldova. I'm just quickly looking if there's any Q&A or any questions so far. I don't think so, right, Mariana? All right. Just gonna scroll. Natalia left her hometown Mykolaiv that was heavily attacked since the full-scale Russian invasion. The Mykolaiv administration arranged evacuation buses to Poland, Moldova, and Romania. She found out about the buses online through public social media, but the city administration also posted this information on their website. She decided to go to Moldova because it's close to her hometown and people mostly understand Ukrainian Russian. The knowledge of the local language is often a factor for deciding on people's destination where to go to. They crossed the border on foot, took one of the free buses to Kauseni, where they are based now. At the border, Natalia said they were met by volunteers who provided them with warm food and SIM cards. Other humanitarian aid was available too, like power banks, food, and hygiene products. There was a refugee camp where people could stay for some time. When Natalia arrived in Moldova, she didn't have an international passport, so legal consultants at her hosting center gave her the information and supported her financially to register for one with the Ukrainian embassy in Chisinau. She said it was also hard to find her own accommodation in Kauseni, and she searched for 2 months. Some landlords didn't want to rent to refugees. Eventually, she managed to find a 3-room apartment where they're all staying right now. Natalia heard about cash assistance from other refugees from Ukraine and found more information online. She called the UN office and they explained how to register. She had to pay for bus tickets to the capital Chisinau to register in person. The UN only recently opened an office in Kauseni. Traveling so far with 3 kids was quite exhausting. During the registration, they had to show their passports and register their fingerprints. And after that, the first payment with the bank was received within 5 days. Sometimes the payments are delayed for 10 to 15 days. The money covers their rent, housing bills, and basic needs. Besides the cash assistance, her only source of income is her husband's salary, but food, housing bills, and clothes are more expensive than in Ukraine, and she can't afford everything she needs. And we asked people how long after crossing the border with Ukraine they first received cash assistance. And in general, refugees in Poland said they wait a bit longer to receive initial financial assistance. Only 60% of respondents received it in the first month, which is compared with Moldova, 25% in the first month and 33% in Romania. Almost 75% of respondents who received financial assistance in Moldova and Romania received it in the first 2 months, compared to only 44% in Poland. Natalia said that the experience has changed her a lot. She feels less safe and less sure about her future. But good things have happened for her too. She has met new people, she has attended baking classes, and has now an international certificate as a baker. There are lots of activities for the children. They attend acting classes. There's a space for Ukrainian children to study, and they can participate in different activities. They have laptops and desks for children to study. There are free dinners, pizza parties, and there were also summer camps organized. Natalia once tried to report a conflict she had with a humanitarian representative. She reached her hotline, but the phone was answered by the same person whom she had the conflict with. Then she reported it to the UN hotline, but she said that she didn't hear back. She thinks they should be able to report inappropriate behavior by humanitarian organizations, and also humanitarian organizations should oversee the distribution of aid better to avoid misuse. When it comes to feedback mechanisms, in our social media survey, most respondents say they do not know how to ask questions, file complaints, or provide feedback. Survey respondents in Moldova are most aware, with 23%, and those in Poland least aware, with only 7%, saying they know how to provide feedback. Among people who know about feedback mechanisms, 28% in Moldova and 20% in Poland have asked a question, filed a complaint, or have given feedback at least once. Then on to the last user journey in Romania. In Romania, we spoke to Irina, a 45-year-old woman with 2 children who are suffering from psychological distress in Constanta, Ivan, a 55-year-old man with a disability who moved to Romania with his wife and 2 children in Galați, and Vasil, an 18-year-old man who has managed to gain a scholarship at a Romanian university in Dei. When they left Ukraine, Vasil was still 70 years old. I will present the story of Vasil. As he was scared to be left behind alone without his family. To leave Ukraine, they took a regional train to Kramatorsk, and then they went to the Usorot on the free evacuation train. There they stayed in a refugee camp at a school for 3 days. They took a bus to Orlivka to cross the border by ferry. He said the ferry was quite inconvenient because they missed it in the evening and they had to wait the whole night until 6 a.m. for the next one. There were no issues crossing the border to Romania after that. In Romania, local volunteers gave them food and took them to the railway station. From there, they took the train to Dei. Now they live in Dei, and he is attending university in Cluj-Napoca. He had good grades, so he managed to get a scholarship, but he doesn't know if he will get it for next year. Without a scholarship, he is not sure if he can continue studying. He said Romania is quite expensive for him and that it's hard to find a job and it's difficult to live with no job or savings. His mother and his older sisters can't find jobs because they can't speak Romanian. He also registered for a temporary protection status, and for that he had to go to another city to register. He used public transport, which took 2 hours. With the temporary protection status, he has almost the same rights as Romanian citizens. After registering, he received cash through UN cash assistance programs. I'm just going to skip this one in the interest of time. And then on to the last slide of the user journeys. Vasil and his sister and mother live in a free apartment from the 50-20 program, which they found with support from volunteers. They used to live in another apartment, but had to leave when the providing organization stopped receiving government compensation for hosting them. This happens a lot under the 50-20 program, and they're currently receiving cash assistance, but when the program ends, he doesn't know how they will manage. In Dei, there's not a lot of humanitarian assistance available. They have to go to the big city, Cluj-Napoca, to receive food bags, free clothes and bedding from a church or humanitarian center. Since public transport is no longer free. They need to pay to get to university or get humanitarian assistance, and it's very costly for them. In each country we spoke to, most people said that aid provision has deteriorated compared to 3 months ago. We asked this question in January, February in our social media survey, just when winter was coming to an end. People in Poland were the most negative. 78% said that the situation with aid had worsened, with 53% said it had worsened significantly. Vasil mentioned that he lacked the opportunities to socialize in Dehi, and he travels to the university to see the Ukrainian community that is quite active there. He would like to have more youth hubs where he could communicate with his peers and find new friends. The Ukrainians surveyed in Romania have relatively better knowledge of English than the local languages. People require sufficient knowledge of Romanian to socialize and find jobs. I see there's a question. 2 questions related to temporary protection. Is the cash assistance in Poland and Romania linked to the temporary protection? And in Romania and Poland, do refugees have to present a proof of residence? And if yes, what kind? I will pause this question for a second, go on to the recommendations, and then I will ask if maybe our speakers can answer this question. On to the recommendations based on the user journeys in the social media study. People ask improved access to information. Make sure that all the information is relevant to refugees from Ukraine and that it can be accessed in a central place, such as an official website. Keep the information up to date and provide it in relevant languages. Use multiple channels for sharing information about humanitarian assistance and the situation of refugees in their host countries. The appropriate channels should be chosen in consultations with representatives of diverse groups of refugees from Ukraine to ensure they are accessible and trusted. Provide comprehensive information about humanitarian aid on leaflets or information posters with registration, application instructions for older persons and other refugees from Ukraine that are not so digitally literate. Provide comprehensive information on medical service, especially for people with disabilities or chronic illnesses, and develop information materials about how to navigate the medical systems in host countries. Address language barriers. Support programs and initiatives that help refugees from Ukraine to learn the language. This will help them access services such as medical services and will support them entering the job market. Help refugees from Ukraine to find people speaking the local language to help them accessing information, accessing health services, and handling bureaucratic hurdles. Establish continuous dialogue. Design feedback mechanisms together with representatives of diverse groups of refugees from Ukraine. These should include diverse channels that are accessible to people and build trust by responding to feedback and demonstrating how refugees' feedback is listened to. Make sure that the feedback mechanisms are adequately staffed and calls are responded to. Clearly communicate about the right of refugees from Ukraine to share their candid feedback and how this can help to improve the support provided to them. Improve distributions and organize aid provision and aid distributions in a way that avoids queuing for vulnerable groups, such as people with disabilities, older persons, women, and families with small children. Or consider giving these people priority at distribution lines. Adopt more flexible registration modes and aid distributions, for example, digital vouchers instead of aid kits, that can also help to reduce long queues at distribution points. Decentralize humanitarian aid, making it available locally and closer to small cities so that regular travel to larger locations is not required, especially for people who have difficulties with mobility. Address tensions between host communities and refugees from Ukraine and ensure that both refugees and host communities are supported by improving area-based programming and coordination in partnership with local authorities. Support the co-design of projects that aim to promote exchange between refugees from Ukraine and local host communities. So those were the findings and recommendations I wanted to present, and I will hand over back to Mariana and see if there's any questions in the meantime. We have not forgotten the question from Daniela, so maybe we can ask our speakers.
Yeah, thank you, Rike, for presenting. And before opening the panel discussion, I want to voice a question from Onyango in the comments section, which is related to the design of the study. So what informed your choice of the target groups for the study? So maybe I would address it either to you, Rike, or to Sergey. Please go on.
Maybe you can answer it, Mariana, for the qualitative research, and then Sergey can answer it for the quant.
All right. So I will start the answer. The quant survey, so the user journey survey, was conducted after we already have had some preliminary results of the social media studies. So based on the preliminary analysis and findings from the social media quant study, we've seen that this group of people, women with kids and people with disabilities, constitute from one side the majority of refugees. So mainly women are allowed to leave Ukraine, but also men who have some issues with their health, so have an official disability status in Ukraine. And both these two groups are very vulnerable and face a lot of challenges accessing aid and during their travels. Also, we identified that the Roma community in Poland is extremely vulnerable. So we wanted to analyze more deeply what is the perception of Roma people of humanitarian access in Poland, as well as the young people who leave Ukraine often without parents or without support or any support structures, and often, they are left behind by humanitarian assistance because they lack very practical social experience in dealing with bureaucracy, dealing with different bureaucratic requirements in the host countries. So these were the reasons or the rationale why we decided to do the user journey stories for this 4 target groups. And I'm passing the mic to Sergey.
Yeah, as was a quant part of our research, with the target group selections are quite broad. So basically, we saw all the people who received aid, at least one type of aid, at least once in the cross the border with a current host country, and whether it's also people who are currently who are in need. At least one had at least one need for the last month. So basically, as we saw from our study, these two groups are mostly overlapping, so 100% overlap, and this target audience is the same, basically what we used in our research in Ukraine. So, and if in Ukraine we had some kind of differences between people in need and people who received aid. So here we saw what basically these two groups are mostly the same people.
Thank you, Sergey. Thank you, Rika. So in case there are no other questions related to the survey, and here I will ask Rika for help with monitoring the Q&A.
Yeah, maybe Mariana, the question of Daniela. Could I ask Irina if you could answer maybe the question, the situation about Poland, because you're probably more aware of that than we are. So is the cash assistance in Poland linked to the temporary protection? And in Poland, do refugees have to present a proof of residence? And if yes, what kind? Would you be able to, or Sarian, to answer this question?
Thank you, Rike. Can you hear me?
Yeah.
Yes.
Thank you. Maybe without going too much into detail, but the cash assistance program in Poland has undergone several changes, and it started initially as a multi-purpose cash assistance programs, basically covering whole population. concurrently transformed into something that was more like, targeted and linked to the protection needs, heightened protection risk identified on individual situations. So, and we do have, in addition to UNHCR's protection program, we do have quite a number of other protection cash interventions implemented through partners in Poland. So maybe to answer the question in kind of brief way, like yes, it is targeting the target group under the current cash program, or like since the beginning, since the onset of the program is temporary protection status holders, i.e. Those Ukrainian refugees who fled as a result of the Russian aggression war in February last year, and they continue to constitute the core group under this cash program. In terms of linkage to the residents and so on, I'm not sure of this technicality, but indeed, refugees approaching, contacting UNHCR for this program, for this assistance, need to present proof of their status, vessel registration in Poland. Thank you.
Thank you, Irina, for clarifying. And here, maybe we will also come back to this question during our panel discussion and have some more information and clarifications. With this, I want to start our panel conversation and to invite the speakers to switch on their cameras, and also ask Rika to stop sharing the PowerPoint presentation so that we can see the faces. I want to remind everyone that our Q&A function is open. Rika will have a look on it and voice if there are any questions related to the conversation. Also, if you have any issues with working with the Q&A function, you're welcome to post your questions into the meeting chat. I will also have a look on it and follow what's going on there. So right now, I want to invite our respected speakers to introduce themselves very briefly, your name, your organization, and your role in your organization, and maybe just like 1-2 sentences about how your organization is supporting Ukrainian refugees in the country. So let's start with the Polish people. So Irina, you already have had your mic on, so please continue with the introduction. Then I will pass the mic to Sarian, Monica, and Sarah.
Thank you, Mariana, and many thanks to Ground Truth Solutions for inviting UNHCR Poland to speak about our program and interventions with partners. My name is Irina. I'm Senior Community-Based Protection Officer and the lead of the AAP working group within the coordination mechanism in Poland.
Thank you, Irina. And I'm now inviting Sarian to introduce himself and Migration Consortium Poland, the voice of NGOs in Poland.
Hello, nice to see you. I'm Sarian Jarosz. I'm a research coordinator of Migration Consortium. And we just published a report, Polish School of Assistance, and Migration Consortium is 9 main, probably, migration-oriented and human rights organizations in Poland, including Amnesty, Helsinki Foundation for Human Rights, Homo Faber, and Ukrainian House. And we are mainly, let's say, the umbrella organization for those organizations to coordinate our work, advocacy and research, especially on the refugee reception and integration at the Polish-Belarusian and Polish-Ukrainian border.
Thank you, Sarian. Also, thank you for joining. Monica, the mic is yours.
Thank you. Hello, everyone. I'm Monica Vazquez. I'm Associate Interagency Coordination Officer at UNHCR Moldova, and I'm also the co-lead of the Accountability to Affected People Task Force.
Thank you, Monica. And Sarah Martin, please, would you like to introduce yourself and your organization?
Hi, everyone. My name is Sarah Martin. I am the Capacity Building Advisor for the Safeguarding Hub Eastern Europe, also known as the Resource and Safeguarding Hub Eastern Europe. We focus on safeguarding for working with local CSOs and local NGOs to improve their safeguarding response to Ukrainian refugees. And we have national hubs in Poland, Romania, and Moldova. And we also have a regional work, which I predominantly do with a help desk and webinars that we offer. Nice to meet you all.
Thank you, Sarah, and nice to meet you. Again, thank you so much, the team of speakers that you find time to join the webinar and to share a little bit of the experience from the countries. So let's start our conversation with a very, let's say, broader question. So our research, as you've seen during Rika's presentation, covered non-capital cities. So we tried to go outside the main humanitarian structures and channels, except the city of Warsaw in Poland, where we talked to Roma community. But in general, we try to work in locations which are more remote. So here I wanted also to ask you about your experience reaching people, Ukrainians in non-capital areas, remote areas, and what are your observations, maybe key conclusions and challenges with regard to people who are staying outside main transport and humanitarian routes? So let's start with Monica. Could you please share your experience?
Yes, well, I think that's one of the major challenges we have, like the organizations, the support, the aid, it's naturally in the main cities. So yeah, we have been struggling a lot on reaching out those that are on the villages and are less connected. However, many of the partners of the refugee response have mobile teams that we are using not only to provide services, but also to ensure they inform accordingly or provide updates. So we have been working with the mobile teams. Also, we have been expanding our efforts both online and offline outside not only our center or the main cities or even the accommodation centers, but also in key spaces for the community centers, or maybe other spaces that we know are popular for people in general, not specifically Ukrainian refugees. And lastly, we push really hard our green line. It's a toll-free number available in the country in the 4 languages. So we also promote heavily the number so people can call us anywhere. And finally, we launched Services Advisor, which is a platform for the organizations to promote their services. So also we were supporting with that.
Thank you, Monica. And I am passing the mic to another UNHCR person. Irina, could you please share your experience in Poland?
Thank you, Mariana, and thanks, Monica. I think we are very similar. I mean, in a similar situation here in Poland, as Monica described. We are working with a wide network of partners who are providing, as part and parcel of their interventions, they're providing mobile outreach to the remote areas, semi-urban locations, which host significant numbers of refugees. We do have a countrywide coverage through the counseling line, which has been lately expanded also through collaboration with the Ukrainian consulate in Warsaw on provision of the information, more pertinent information related to updates in legislative framework back in Ukraine and so on and so forth. more lately, also this counseling line has become a part of the regional contact center, which extends kind of its scope across the region. Community centers, yes, we do have several community centers, most of which are transitioned from the blue dots. I'm pretty sure that colleagues here are very much aware of this experience in the Ukrainian response. We also trying to support the municipal actors and the national government, the central government, with the integration initiatives and projects that are actually focusing on remote areas, on peri-urban locations. One example of this, I think, Polish know-how is the pilot project by Minister Ścigaj on integration, which is currently running across 5 different locations in Poland. So accompanying, working through the wide network of partners again, accompanying the initiatives, and also learning from more local approaches on integration. Poland, as you know, has been hosting significant numbers of migrants and migrant population and refugee populations before the Ukrainian crisis. So every municipality has a lot to offer in terms of learning experiences and knowledge. I'll stop here. Over.
Yeah, thank you, Irina. Right now I want to pass the mic to Sarian, who I know you have a lot of experience on the ground and maybe can offer a kind of a critical or alternative perspective how things are working on the ground in these remote small communities. What are the key challenges? Are there any good practices that are really working within the Ukrainian response? So the mic is yours.
Okay, thank you. I don't want to be a devil's advocate, but that's true that we are working since the very beginning on the ground. We also conducted the research in 13 Polish cities, actually much more, but 13 Polish cities within the last report, Polish School of Assistance. Before I worked also as a border monitoring expert and researcher for Amnesty International. Since the very first days, I had the opportunity to see the reception efforts and the quality of the humanitarian assistance, especially to the vulnerable groups, such as Roma, people with disabilities, LGBTI. And unfortunately, maybe I will start from these. And right now we're also releasing 2 reports. One report on the legislative changes based on the field work in 6 regions of Poland, on the collective accommodation and the legislative changes in collective accommodation. Probably I will have the opportunity to say more a little bit later. And also on the reception and integration of the Roma community, specifically in Przemyśl and Warsaw, with Foundation Towards Dialogue, which is a Roma organization. And I also work on the LGBTI refugees reception, so it's like a lot. But good practices and bad experiences. I have to say that what we recognized during our work in 13 small, medium, and big cities of Poland, municipalities, we recognized, unfortunately, the huge role of the local organizations in the big cities and the networks of social sector, often with the interesting intersectoral cooperations, which were specifically successful with the private sector, a little bit less successful with humanitarian organizations, NGOs, but still with the good standards. But this is also a difficult topic on the way of the humanitarian response and humanitarian responsibility. And almost all of the most of our data has shown the very absent, reluctant role of the state authorities, especially central authorities, but also local authorities. So to go to the short, the unfortunately response, reception and integration differed a lot between specific regions and also specific cities. The good practice was actually engaging of the local Ukrainian diasporas, but also Roma diasporas and communities within the reception and humanitarian. It worked also in Przemysl. I'm happy to see UNHCR here, but it worked very well with the engaging of the Roma community assistants in Przemysl. This is something that the city of Przemysl unfortunately didn't recognize. In the small cities, there were self-organizing bottom-up groups that were providing reception and integration. In bigger cities, it was networks of social organizations. And unfortunately, a year after, what we see is that this fatigue of social sector and civil society is unfortunately influencing the rise of the anti-Ukrainian and anti-refugee approach and rhetorics. Which is particularly harmful considering the upcoming elections. So this is something that we recognize and we are trying to get prepared to.
I will stop you here, Sarian. Yes. In sake of time, we will have another section also to talk about the fatigue of local actors and the compassion fatigue. Thank you for highlighting this at the very beginning. Also to remember for us that this is a topic which is very important. Thank you for sharing your observations in terms of good practices in non-capital areas and remote areas. I want to continue with the second question, which will be also very important right now. So since our research was done, the quant part in January, February, and the qual part in March, April, the situation in the countries for Ukrainian refugees changed. So there are certain legislative changes and also the amount of the response. When we have been talking to Ukrainians in March and April, many of them in all three countries highlighted that they know something will change. They were not so very well informed about the essence of the changes, but were expecting that this will affect their lives in the host countries. So with this question, I want to address Monica. What can you tell, or if you can tell us more about what has changed since March 2023 for Ukrainians in Moldova and how it will impact or is already impacting the life of Ukrainians?
Thank you. For Moldova, this is very relevant, and considering the research period for the assessment is like from January to June, being the first part entirely during January and February, this is very relevant because Moldova didn't have temporary protection in the past. The Moldovan government approved the decision in February, and temporary protection entered in force on March 1st. So on March 1st, Ukrainian refugees and those eligible could register for temporary protection in the country. The registration is still open, it's ongoing. And but definitely that's a big change compared to other countries in the region. When people in Moldova, they were entering and they had full access to rights and services based on a declaration of emergency from the Moldovan government. And now there is the temporary protection procedure in place, which also, well, mainly it's the legal stay in the country, but it's also linked to access to rights and services like basic education, like primary health care, and many others. And there's even more changes coming our way, which definitely impact the aid and the whole situation and the information provision. Because the state of emergency, this clause that allow Ukrainians to remain in the country without any particular procedure on any further registration or documentation, it's coming to an end as of August 13. Every Ukrainian refugee need to actually secure a legal stay in the country. Being temporary protection the most accessible, but well, depending on each case, each situation, they might go for a residency or like a work permit, or like, of course, asylum. It's always like an option for those that require it. So yeah, so basically this is a big change for us.
Thank you, Monica. Indeed, in our interviews, we've seen that Ukrainian refugees in Moldova are those who almost didn't register, so they just come into the country and try to avoid any like legal procedures as long as they can. So definitely this will require a lot of engagement with the state institutions, with bureaucratic procedures for many of the Ukrainians. All right, let's have a look on Poland. I know that there are significant changes related to housing situation for Ukrainians, but maybe some other legislative or political changes. So Sarian, the floor is yours. You already touched the topic of political landscape and the changes in the political situation in Poland, maybe a little bit more about the legislative things for Ukrainians.
Maybe I will touch upon the two topics. First one is, of course, the legislative changes that were introduced in January 23, which is right now in at work. We just evaluated the legislative change to the Act on Assistance to Ukrainian refugees, considering the participation of refugees in the collective accommodation, which puts the responsibility of financial responsibility even to 75% for refugees to pay for their own collective accommodation and humanitarian assistance provided by the state, which, as we see, was also very badly communicated and coordinated between the central and regional and local authorities, specifically to the social sector as well, and to the refugees themselves, which results, as we observe right now, which results to actually the rise in last months of refugees themselves to come back to Ukraine, even if there is nothing awaiting for them. So it's actually a particularly risky legislative change. Unfortunately, this is something that we are afraid will be trending right now in a way that it will, set the discussion on the refugee response from the state representatives, especially before the elections. So the second, I think, very probably you know about it already, but the announcement of the referendum on migration, the Migration Pact last week by the Polish authorities, is particularly dangerous for us and worrying. In the way that as much as it seems to be only about the Migration Pact, unfortunately, it's also a very useful tool from the ruling party as well, to sense and recognize the social approach, the public opinion on the refugee reception and generally refugee refugee reception in Poland, which unfortunately can lead to specific setting the pre-electoral debate. And we've already observed it in 2015, 2017, 2019. So unfortunately, this is a pattern that we see, and we are getting prepared to this. There are smaller legislative changes as well. Unfortunately, there is a very little of the communication and coordination of those changes to local and regional authorities, even when it comes to this housing situation, in which there is no, there is not active engagement into widening the into fixing the deficit of social and communal housing in Poland for refugees. But at the very same time, there is an active legislative change that puts the refugees themselves into the risk of eviction and homelessness, as particularly the vulnerable groups, also people with disabilities who will not be, because not all of the groups, there is a possibility to apply for not participating in this in those costs of collective accommodation, but it needs mostly it needs assistance from the social sector and social organizations. And as we talked about remote and small towns and cities, this is something, you know, the social sector is not that well developed and often professional or able to assist every refugees in those places. And due to the programs of relocations to the smaller remote areas of Poland from the bigger municipalities, this is actually quite, I would say, inefficient. And this way, those refugees who actually would be in need of assistance and help and will not be able to even have access to the labor market to activize themselves in a professional way, those will be at the very same time those who will not also get the assistance from the social sector. So as we see, all of those components are very much intertwined, and unfortunately, it is a little bit of the interconnected, you know, legal limbo. And we are awaiting next changes, of course. And sorry, just last sentence. I would also like to see, compare that these legislative changes and also legal practice also is affected by these double standards at both borders, Polish Belarusian and Polish Ukrainian. In many cases, the social sector that is working at both. Not really. So the organizations are working on both borders and they are treated differently, and they are affected also by the for example, criminalization of solidarity at one and the absence of the state at the second one. So this is also the legislative reality we work at. Thank you.
Thank you, Sarian and Monica, for giving us an overview about the changes. And also, again, Sarian, for highlighting the role of social sector and non-governmental organizations. In our research, we've heard from Ukrainians that they really rely on the support of volunteers, small NGOs, civil society initiatives in the countries, and receive very practical on-ground help to navigate the aid and to navigate the life in the communities. So I want also to hear from our speakers, what are you hearing from this diverse groups of volunteers or institutionalized initiatives on the ground? How are they dealing the overwhelming requests on the ground? What's at their state right now? I want to address this question to Sarah, who is having an overview in the region, and you maybe can talk about all three countries.
Thank you so much for that, Mariana. As I mentioned earlier, we work specifically on the lens of safeguarding, looking at sexual exploitation and abuse as well as discrimination, which is, you know, a very important topic in this response. We conducted ourselves 3 country needs assessments in Poland, Romania, and Moldova, and which we published in January. And one thing that came out loud and clear, particularly from our colleagues in Poland, because we focus on the local CSOs and the local NGOs, was an overwhelming kind of sense of burnout. And as Sarian mentioned earlier, that particularly in Poland, they had been working on the border with Belarus for before the war the war in Ukraine started. Often, you know, small groups of friends, maybe people with disabilities, helping other people with disabilities, small LGBTQI organizations reaching out to help others that were fleeing, a huge outpouring of goodwill to receive the refugees, but with very little support and overwhelming needs, as you mentioned. I also saw this when I was working in the Syrian response in Serbia through the Balkan routes when people were coming through. And there was, this was 5 years ago, so there was less discussion about the mental health needs and the ability to support local organizations. So there's more talk about it now, but there's still not much there for them. One of the things that we heard was that there had been, both in Ukraine and in Poland, letters written from local organizations to the international community, kind of outlining some of the concerns they had. You know, we always struggle in the international community with coordination. And one thing we saw through the lens of the safeguarding was multiple trainings. People were expected to attend multiple. One NGO, poor NGO, had to do 7 trainings on safeguarding in order to get their funding from their implementing partners. And so I think there's we're starting to see some frustration, some exhaustion, people leaving the field, which is very hard because they worked so hard and they supported the refugees so well. But people can't work at that pace constantly. There needs to be more attention to supporting these local NGOs, maybe a bit better coordination on the international community side to help make sure that we're not doing nonstop meetings, which can wear you out. Also just really looking down at the most vulnerable people. Many people have mentioned it in the different discussion groups here too, but working with traumatized people who have come from war zones and then themselves may have already been experiencing discrimination and harm before the war as well. It's very difficult, and then it's very difficult to help them sometimes because of the way that trauma impacts. So having maybe a more trauma-informed approach to some of these extremely vulnerable populations would help both us in how we respond, but also help support each other so that we don't burn out and have to leave the field. Thank you very much.
Thank you, Sarah. I want to address the same question about how the small NGOs, volunteers are working on the ground to Irina. What is your experience with your local partners? What are you observing? Yeah, the floor is yours.
Thank you, Mariana. I think I agree with most of the points that Sarah mentioned, and also Sarian raised some of the concerns that are prevailing amongst the NGO community here. So we hear like reports of the burnout, of frustration, kind of limited understanding how the funding mechanisms work, maybe. There is an increasing focus in terms of interventions that we are trying to ensure on the ground, an increasing focus on mental health and psychosocial support to the staff of organizations. Many of them are Ukrainians, and many have gone through the same level of trauma and loss. So in terms of like shifts that we observe at the broader community level, Poland regularly conducts these like what is called the survey, like on social acceptance. So this is done by the Center of the Public Opinion Research. So far, I mean, the vast majority of Poles have been supporting the idea of Poland accepting Ukrainian refugees. But obviously, as mentioned, as flagged by Sarian before, the dynamics are changing at the intercommunity and intra-community levels, right? So we see more and more kind of resistance on the part of certain community groups in terms of them trying to understand the reasons why refugees are not so much integrated into the system and remain reliant on the humanitarian aid. We have to also consider that a significant part of the population actually are elderly or people with disabilities and people who have been exposed to different types of trauma. So it takes a really some time for the newly arriving refugees to come to understand, to access the services on the ground, right? The good thing is that the 30%, according to the MSNA results that we had last year, 30% of population in Poland is employed, so it is activated towards the job market and so on. but still there is a lot observed in terms of like needs, need for additional support in terms of matching skills, Polish language learning, and so on and so forth, right? So our key points would be like, in terms of shift is like, delivery of the supportive interventions to those who provide services. I mean, focus on those who cater, who attend to highly traumatized population. They are in need of support, and also perhaps strengthening coordination mechanisms, but also ensuring a bit more transparency when it comes to our role as international organization, and our mobilization capacity in terms of resources allocated to small community level organizations, to support them in their role. Thank you.
Thank you, Irina, and thank you, Sarah. It would be very ridiculous if I wouldn't give the floor to NGOs itself and to have the voice here. So, Sarian, please, if you could make it like up to maximum 2 minutes, what has not been flagged right now in terms of the state and the conditions of work of NGOs, volunteers on the ground.
Of course, thank you, Mariana. Yes, what to bring up. I think it's exactly how you said. We observe also in the civil, what we face in the first stage of reception. It was this incredible civil society mobilization and civil sector. Unfortunately, it's right now long lasting, and there is this compassion fatigue that we observe among the civil sector, but also among the civil society, which can be easily instrumentalized in upcoming months. We also see the invisible groups with vulnerable groups with special needs. Also the groups that are usually not covered. But what we see, and I would like to mention it, is the anti-Russian speaking sentiment that we observe in the society. So exclusion and also, let's say, this first race of the anti-Belarusian and anti-Russian community in Poland. Many of those actually fled through Ukraine from Belarus and Russia, but unfortunately what they meet right now is hostility. So the social memory of 2020, for example, and the protest 2020 in Belarus is very short. And this is one of the groups that we wanted to identify, because it's also very easy not to notice them, but it's quite a huge group in Poland. The same with Roma community. There is generally a huge need of intersectional approach. There is a lot of cases that we are right now reporting on the border racism as well, but also the racism in access to integration services such as education, such as health system, and unfortunately it only fuels this compassion fatigue, because from one side the situation that the housing and labor and education market in Poland was already bad, maybe just not great, the access was not great, and unfortunately right now it's also influenced with this access to refugees and easily weaponized by the politicians and public opinion against the public, also the civil society organizations, and also against the refugees. But one of the main problem also, sorry, 2 sentences, I promise. Yes, I know. One problem that I would like to mention that was not mentioned is the growth of the NGOs, which is some of the organizations were 10 people, 5 people, right now they are 120. And the presence of the Ukrainian diaspora and migrants in all of these efforts, which is additional level of stress and fatigue from the refugees, Roma and Ukrainian refugees engaged directly in huge need of psychological help, engaged directly into the humanitarian response. So this growth, unfortunately, is not sustainable. And what we see is, and many of the organizations already observed, is this withdrawal of donors, withdrawal of the international organizations, and uncertain future that we are right now trying to face, knowing that, the invasion didn't end, the work didn't end. Right now, we are in the difficult stage of integration. And at the very same time, the organizations will have to maintain their work with sudden withdrawal of funds. And last aspect of this, I promise, is this. I would say that our unexpected ally was private sector, which was very, very surprising for all of us. And the relations with, I would say that our experience with international organizations is quite complicated. We are learning, but there are, for example, there is generally something I would like to, I promise my boss to tell today. So there is this, I would say, unexpected situations in which organizations who were so far about education, integration, intercultural education suddenly became humanitarian. So those organizations who didn't want to be humanitarian, right now they are humanitarian, and they also have to meet the standards of international humanitarian organizations, which is very difficult, and which is actually a role that most of those organizations don't want to hold, especially the migrant-led organizations don't want to be humanitarian organizations. So at the very same time, because it adds additional duty to their already quite fatiguing work. So this is the thing in which we didn't really have, as Poland, that much of the humanitarian experience. It is humanitarian part, work. So right now we have to learn fast, and many of the organizations actually hope for it to, to come back to their daily tasks that they abandoned and to the integration part. Thank you.
Yeah, thank you, Sarian. And I see Sarah's hand. I will hand over to you in a moment. So as we are getting to the end of our webinar, I would like to open the final round in the plenary. Sarian already mentioned some of the next topics or some upcoming topics, and I want to address Sarah, Irina, and Monica. What are the upcoming pressing issues or topics that you are going to address in the next months or in the next period during this year? So Sarah, the floor is yours.
I just want to re-emphasize what Sarian was saying as well, that the burnout is not necessarily from doing the work with the refugees and speaking with the refugees. It's due a lot to the uncertainty of the funding, to the short-term contracts, to the many onerous policies that international NGOs tend to put on to their local partners. And I agree with him 100% that it's really very unfair. We pay a lot of lip service to the term localization, but if we were actually looking to see what support they need rather than telling them what they have to do to meet our standards, then things might be a lot better there. What we're going to be doing in the next couple of months is our project runs through October. We are also a victim of the lack of interest in 2 years after the war, where safeguarding seems to be less of an interest to donors right now. So while we're still looking for support, we'll probably be wrapping up, but we will continue to focus on supporting local CSOs. We do have a help desk that I mentioned in the chat. So if you have a question, if you're from a local CSO or NGO and you have a question around safeguarding, you can write to us and we'll provide support. And we're also doing coaching for CSOs on how to improve their own policies and procedures to make their organizations safer for themselves and for refugees, and we contextualize it to what they need rather than giving them just a template to fill out. So we'll be doing that, continuing to work with our CSOs and trying to raise our voice where we can on behalf of the local CSOs as well. Thank you.
Thank you, Sarah. Monica, a couple of words from you about some next upcoming priorities or focus areas for UNHCR in Moldova.
Yes, well, beyond UNHCR, more as part of the AAP task force, we'll have a big round of accountability and community engagement trainings with particular focus on a training of trainers. So hopefully we'll build capacity on the Moldovan community so we can mainstream accountability. Well, actually, I saw in the recommendations, I'm very happy to say that we're actually redesigning our mechanisms. We really need to think about this. We need to think and learn more about what, like, even when people is like using the mechanism, it is not truly for complaining, or it's not being effective. It's not as effective as it should. So definitely a lot of work that needs to be done there. And well, we are also with other working groups and task forces, there is a big interest on aligning a bit more our communication in relation to the services, as right now it is too many of us providing too many services, so it's confusing out there. So yeah, a lot of efforts to coordinate better on that sense. And well, we'll have like a big push on temporary protection, as it is important for all the refugees in the country. So some of the activities on the next months.
Thank you, Monica. Irina, the mic goes to you.
Thank you. Similar, maybe, I mean, a few points on like UNHCR, like what's on UNHCR to-do list, and maybe to present second point more from the AAP working group perspective, which the working group brings a number of actors who have been continuously involved in, like, you know, shaping up response, like fine-tuning the work on harmonization of complaints and feedback mechanisms, like reach out to communities at risk, and also mapping of the AAP tools. So there's been a lot of work that has already been invested into, like, you know, into response, humanitarian response providers, and we do see like results of this work in terms of operational landscape. Like we do see a bit more coherent approach towards consultation, like, you know, consulting community participatory methodologies being applied throughout the programming circle. So it's all encouraging, but I mean, taking it forward, I think we will have to build on, like, you know, on the experiences brought by like more grassroots organization and refugee-led organizations and networks in Poland, taking their priorities more into account, and also programming or kind of embedding their preferences on receiving feedback, or, like, you know, addressing feedback to humanitarian aid providers, like more into our within the ambits of our program. So as UNHCR, I think we will continue in terms of like our work with the capacities, skill sets, and you know, talents within the community to really to promote the inclusion of refugees, and address like worrying trends, like related to inter-community dynamics, promote social cohesion as well. And here the role of the organizations, like local organizations, cannot be estimated. I think like they all bring a lot of experience and technical offers as well in terms of addressing very specific elements of the programs. But again, knowing that it's a complementary kind of interventions which support inclusion of and quality response to persons facing protection risks, like whether it's you know, women, men, LGBTIQ, persons from ethnic minority background, and so on. So the complementarity of services has to be also strengthened through refugees' access to national systems and services provided through the national system. So I think to that extent, our advocacy role and role of UNHCR's role as a convener, like, you know, and coordinator, should be taken into account. So this is in brief from our side. Thanks.
Thank you, Irina, for sharing, and everyone here in the plenary for sharing your good practices and your next steps. The chat is very active. However, I don't see any pressing questions. We have a couple of minutes left, so if Rike, you could give me a hint if there is anything happening in Q&A, we can maybe voice one or two questions and then wrap up
Nothing from Q&A so far. I did post in the chat. Please do in the last minutes, if anyone has a question or comment, please feel free to share. Also follow up, I will post our email addresses in the chat. So we're also available for bilateral conversations if necessary. And I just want to flag before I hand over to Sarian, because he has his hand up, that if there's a wish or a need for these findings to be presented in a more local forum, in a working group meeting or in anything, feel free to reach out. We're always happy to present the findings another time as well. So please do reach out. We'll put our email addresses in the chat as well. And then over to you, Sarian.
Hi, thank you. I just also wanted to share a bit our plans because that might be interesting for you. So we are right now finishing this collective accommodation and Roma report. We are right now also working together with Mariana on ODI humanitarian policy group report on mapping humanitarian narratives, which I think that's quite impressive project. I'm very happy to do it. And we try to frame it. We have 2 lines. One of the lines is like recognizing specific issues. As we are 9 organizations specializing in different aspects of work and different groups, we also, let's say, coordinate our research apart from the whole next 2 years. There will be also the research on the intersectional response to LGBTI plus refugees from Polish-Belarusian and Polish-Ukrainian border. I just finished the scoping and I'm super happy to share it, but we are planning to do it in winter. In autumn, we will publish a report on localization and the cooperation between NGO and ENGO sector in Poland, considering good practices, but also the experiences. And I know that I think we have quite many plans also. There is Ukrainian House also wants to publish a report on the inclusion of migrant communities within the refugee reception and the experiences and good practices. That could be very interesting because it's quite a unique experience. Connected also with the digital practices of reception and integration and self-organization. So there are a few things. I'm happy to share with you our plans. I'm also happy to know better my plans. So this is the discussion we'll have in the middle of July because there is a lot of plans. Fortunately, we secured the fundings for our research. So we are also cooperating with other like NGO Together Forum, so the other actors who are conducting research in Poland.
Yeah, thank you, Sarian, also for sharing this. As I followed the chat during the our plenary discussion, I see that a lot of very useful resources are there. So maybe with a follow-up email, I will ask all our speakers to send us links, information you would like to share with our extended group of the webinar participants, that we can also send out a follow-up email with the link to the recording, but also to all the materials you mentioned during the plenary discussion and the materials you think would be useful to distribute to the participants. I think we have had over 70 people registered and over 40 participants participated in this webinar from Ukrainian, Polish, Moldova, Romanian organizations, as well as international humanitarian community. So feel free to think a little bit more about what you would like to share. To all the participants, very much thank you for being present with us and also sharing your feedback, comments in the chat. That was very, very helpful also to see what resonates with you and to guide the discussion. Thank you for Rika and Sergey and for Ground Truth Solutions for convening the webinar and for presenting the findings. That was really very exciting, even for me as a person who was very into the research, but really very thank you to have the overall picture and to linking the qual findings with quant findings. That was really packed with a lot of information and insights. So maybe for a couple of final words, I am passing the mic to Rika and we will close the webinar in a few moments.
Thank you so much, Mariana, for moderating today. Thank you also on my behalf to Sarah, Irina, and Sarian, and also to Monica, who had to drop off for another meeting, and for everyone who attended today. As Mariana mentioned, we'll be in touch in the next days, early next week, with the full report, with the links that have been shared. We will follow up with Sarah, Sarian, Irina, and Monica, and everything they would like to share with you. We'll make sure we put that in this email. And again, I know I posted it in the chat and I said it already, but please do be in touch if you have any questions, feedback, or comments related to the research or to our work more broadly in other contexts. We're happy to be in touch. So thank you so much, everyone. Have a nice rest of your day.